which I think you have heard sometimes. We are working at the region Gävleborg, which is both regional growth, and we have this healthcare. We have hospitals, we have and all healthcare in this region. No, it's working. No, can I use this one?
Yes, you can use that.
And Sigrid and I has a project called Procurement-driven sustainability from a holistic perspective, and that is a long name, but it says what it is. So we're not so good at finding fancy names anyway, but we do a lot. This project was founded by Swedish Agency of Economic and Regional Growth, and we started at 2019 and ending at 2023. We are located at the purchasing department at Region Gävleborg. We have our own little unit there. So, but we're working close to the procurers. We are working in the way we are working together with a lot of people, which I'm going to talk about. We have heard a little bit about it, the frame-like model, which we have founded, I think. And in different areas, we have what we call pilots or tests in real life, or test beds, or whatever you call it. We are participating in groups, working together with procurement documents and the whole procurement process, actually. So we work with Textiles, which Sigrid is going to present soon. We also have sustainable transports and goods deliveries. We have not started that yet, but we will have some kind of work in that area. I work with food and meal, and we also, that you heard, lighting, how was it, as a service. And we can also, if we have some more time, we can talk about, because this is the next step. The one Rodrigo speak about, it was the first case, it was 5 years ago. So now we have another case and doing this procurement. This is the frame-like model. It's crystal clear, isn't it? But actually, Pete and Kate said a lot of words. We were said, okay, yes, we have that. As Rodrigo told you, it's based on the needs. The end user needs, but the whole line of needs in the whole process. And as you also think, as well, Peter, operations, we have anchoring, have a mandate from the management. Otherwise, we can't have this go. So it's important to have that from the beginning. This circular process, you can see this is not line. It's really, this is the curly process. And here you have a puzzle. And we're building up the puzzles. That's why we call it knowledge-driven process, because what you need is a lot of knowledge about what you're going to procure. And this is some words also we always have said from the beginning. This is the third innovation procurement project we are having. And you have to be in place. You have to be there to understand, because you cannot be just theoretical and say, okay, they have so and so. You need to be there to fully understand what's going on. And we have to build some trust between everybody. Trust is a very important thing when you're going to collaborate. Otherwise, it's just not collaborating, maybe trying to collaborate, but it's trust and have knowledge. And also take responsibility, because these ones, they need people who are taking this seriously and really think that it's important to show that there is no risk. We have to do this risk analysis. We have to look at the market. And we have to do this external, what's happening in the world, in this area, stuff like that. So, and collaboration. Collaboration, and as Rodrigo said, we also have communication. It's really important, and we can see it every day. I think Sigrid is going to talk more about it. So this is the most, we have this model for a long time, but it's based on the soft values, actually. And it is the people inside this who makes the difference. We have seen it over and over again. So, and this frame lake, why is it called frame lake? That's really strange, maybe. But that's a really actually a small village at Jonsäll municipality. A small, and I mean small, I think about 500 inhabitants or something. We were there at the first project, working with the need for elderly, and we saw a system, real life system, connecting. This village was built up in a different way, and they trusted each other to help each other. And we saw the system, and we think, okay, this is the way we're going to work together with them. So, but that's totally another lecture, because it was happening a lot during these projects also. But that's more than we have time today, but you can ask if you want. And it's still, I think it's still there, actually, in Jonsäll. They are now having all these village are doing the old official works in this village. They are not going from anywhere else. They are helping each other. So, if we just have it in words a little bit more, you have to anchor so that the mandates and the clear guidelines, as I said, important to start with. Yeah, an external analysis. What we I didn't tell you about this one, how we do it. And maybe that's interesting. With needs. We use the same method as you. We have also background. I have a PhD in food quality, and Sigrid also have a PhD. So we have this kind of work. We're working in a scientific way. So it is possible. It's possible to collecting data, if it's quality or quantity, and we see, okay, is it something's not really right? We say, okay, we get different answers. Then we go back. That's why it's possible to go forward and back. And there's a lot of this early process everywhere. And how we do it is that we are making interviews. We are there in study visiting. We are discussing, talking in the phone, you know, everything, just collecting knowledge and from different actors. And another thing, which is really important, is the knowledge of context, because you can't work the same way everywhere. That's the way we have always done before. It's like, okay, you know, the procurement, we copy paste. That's good. And we get old products, we get totally wrong. We don't know anything about how should it be used and so on. So we have to know the context. Where should we do that? You couldn't do it in the same way in Gävle, for example, and in Bollnäs. You have to look at the context. Who is the people there? How should it be used and stuff like that. So it's very important to know also about the context. And as I said before, create relationship and trust. And you do that by being there. As I said, you have to be there, talk to the people. It takes time, but it's worth it. And I think we have mentioned also, we form an interdisciplinary, we have a group where we clarify roles and how we should work together. We in this, I don't know if you're going to speak about it, but we talked about it before with where we have, okay, the internal, you have different type of knowledge. Internal also, of course, you have IT, you have hygiene, we are working with a lot of this internal, and it has been a struggle actually. So to find all these people and to set them together and say, okay, we're going to procure these, for example, textile. We have to talk about this, but it works. And when we have started and create these relationships, both internal and external, then we can go somewhere, and we can work also with the suppliers in a different way. And we also have this SME companies, which we have as a goal to see if we can we let them into this public market. Is it possible? Yes, it is. We just have to think of how we procure. So, and I'm going to talk a little bit more about that and collaborate. You have never heard about that, but yeah. Dialogue, you know. with all these people. So what experience and lessons have you learned so far? Because this is a never-ending process. I think Peter and Kate have the same. You just learn, and you said something about that, Peter. It's just learning and get more to these models of working. And I thought also that we have heard about a different mindset. Rodrigo was talking about that. We need a different mindset. How could we drive innovation and development for the organization we do the procurement for? And all these experiences have showed us that we need this from the process of finding the real needs, which we're talking about, which is the core. You really need to know those people who's going to use this product or service. What do they need and how it looks like. Through the whole business, the whole process of doing the procurement documents and following up the contracts, you have to be there all the way. And that's the case. I think we talked also about that's not how the purchasing department looks like today. So that is something we're also discussing now. How could we change actually the structure of the purchasing department, because it's not working so well. And we can see that this public procurement, we can use it as a tool to result in innovation and improvements in the organizations and the sustainability, and we can have higher life quality actually, as we saw in this lightning as a service. The children and staff felt more alert. Thank you. You can Swedish. That's good. And they didn't feel so depressed. They were like, yeah, it's better for life. And maybe we could talk a little bit more about these results. But we had this goal also to talk about or to investigate how could we put in SMEs in public procurement. Yes, we could divide these contracts. You have heard it before, I suppose. If we have one big contract, we can make several more, and it's possible for smaller companies to participate in this procurement process. And collaboration, of course, and they can work together and so on. Yeah. So it's harder. What we saw then, we're talking with a lot of small companies. We have the last project, we was working with small companies. And we talked about how about procurement? It's like, okay, what do you think about procurement and why do you not attend and so on? The library is closing. Okay. Okay. They just want to inform you that the library is closing. Oh, no, it's coming. No, I understand. I wait. Yeah, so you can't go there now. The procurer often has less knowledge of smaller companies. We can say that now because I think we have met so many procurers, so we can say that it's. But I think that we have seen a change during this for 5 years or something here in Sweden. They're talking more about SMEs, and I don't know, you say yes, Peter. They are starting to find new ways and really try to feel this SME. How should they be participating? And you really need to understand, I think, as you were a small company, when you're writing these procurement documents. Okay, if I was a small company, could I say, yes, what should I answer here? You just have to put their insight. And also when we saw from the beginning that they wasn't invited, these SME companies wasn't invited to these dialogues and hearings, to discuss different products or sales procurements. And they have to learn about these special needs, maybe about the law things. You couldn't do the same thing maybe in public schools and public. They have some more different laws than the others. So SME also have to learn more about that. And one thing is that the tender, you know, to fill in the tender. It's not so easy if you're 1 or 2 persons in a company, and you should understand and fill in that and so on. So it could be very good to have some organization to helping them to really, you have to work with the under to help them participating. Even if you can't do it yourself, if you're doing a procurement, but there are other people which you can involve. Yes. Some of those I already talked about. Yeah, of course you put in the thing you have found, the requirements on the information you received in the needs identification into and the market research into the procurement documents. Yeah. And maybe think of what kind of requirements do you put in, because sometimes they can't, if they are a new company, they cannot have references, for example, and it depends on situation, what kind of product or services you are procuring. Is it risky or not? Sometimes it's not so risky often as we think. And certificates, sometimes it costs a lot of money to do some labels and stuff like that. So think of all these different when you're writing the procurement documents. Yes, this is, we have heard it before, takes time. You need time to investigate, of course, if you're going to do it in this way. And you need resources also. We have a project. And knowledge inventory, I've talked about that. And I think Sigrid said it, you have to be stubborn. You have to still going on. You feel that, okay, no one is understand what we're doing. But suddenly after 10 years, they, maybe this is good. And in our case, in the textile, it ended up actually in a new organization. So it is development of the organization also to start to work with procurement in another way. This is, yeah, I was talking about that. Okay, Sigrid is going to talk a little bit about textiles, and then we will have some questions, I suppose. Okay. Should we take questions together?
First, I can tell you a little story about being alert. Because the Swedish word for being alert is pig. And I have some former colleagues who was in the US for the first time and going on a taxi tour. And he is sitting in the front and say, chit-chatting with the driver and said, yesterday I was ill, but today I'm big. And the taxi driver didn't know nothing. This is about a case study about textile. Rodrigo talked about when we're doing the lighting in Bollnäs, and it actually doesn't matter if we're talking about lighting, food for elderly, or textiles for healthcare. It's the same frame-like model we used to have. We just trying to understand, because me and Anette know a lot about food. I also know a lot about food, but not just eat it. So, but we didn't know nothing about lighting. We didn't know nothing about textiles. Today, I would say I'm an expert in textile for healthcare. Just test me. In this we always today talk about sustainability. We are not always talking about legalization, but we have to do that as well. But I forgot to write a very important law of the public procurement. But I still do understand that you are aware of that one. Again, that 2030, you're aware of that, because everything we do these days about sustainability is that is what we are following up, so we can stand there and say that this is the very truth. So, and we have some standards, and I am a part of the standard commission with the healthcare clothes to find out how that work is actually ongoing. How can we say that the standard is a good thing to follow? Yeah, you have to be there and watch them. So that is what we are also doing. Try to be as so many places as we can in the particular thing we actually talk about. In this case, it's textiles. So that's why we're involving in everything. We can't actually get rid of. So this is a way of the textile in the healthcare. It's about clean clothes. It's about hygiene factor. And it's about how should these clothes be washed in a proper way. And that is some kind of a circular space. But as we are trying to understand every circular way, as Anette knows the curly process, this is also a curly process, of course. There's a lot of, this is the easy way of drawing it. It's much more complicated if we are going to talk a little bit more about it. But it starts probably here, healthcare, they collecting their clothes. They have this laundry room, and then they pick up the clothes with some kind of transport, and then they wash it, take it back to the room, and it's going on. You can't understand how difficult this could be actually. It makes me depressed every day because somewhere clothes disappear. And we have no idea where the clothes are. And I have never seen a person civil person going with these kind of clothes in the spare time. So this is actually a really mystery how it could be so many clothes disappear every day. When Anette and me started with this project, we have the opportunity to spend all the vacation in the summer in Bollnäs trying to procure clothes for Bollnäs Hospital. It's quite a small hospital, but there is everything there. It's like a big hospital in just a smaller package. So me and Anette, and there was no procurer at all who wants to be with us during their summer period. So we have to have a consult. This is actually true. And that person hated us before, but these days he actually think we are quite nice to be with. Takes time, but that was the truth. So we were sitting there during the summer period because the private supplier who was running Bollnäs hospital before, he said, we won't do it anymore. So the region had to take it over. And that was in the summertime. And it's quite, if you have some idea how long it takes to order clothes from China, you will know this is a hard thing to do during 3 weeks in the summer and try to have it functional in August. It's almost impossible. But we're learning a lot about clothes. We're learning a lot about what the suppliers said that this circle is and what it actually really are. So we started to make an own circle. And we also start to collaborate, because when you have, if you do know nothing about clothes in the hospitals, we try to learn. So we have to go out and ask people, what is your real need? And there is a lot of different real needs in a hospital. And someone is real needs, and someone isn't real needs, so you say it's real needs. So you have to ask them again and again and again. And for the second time and the fifth time, you probably heard the real need. Because they say what the first answer is always what they think we want to hear. And if you ask them again and again and again in the different angles, you're going to come a little more close to the truth. So that's how we learn, by doing this a lot of time. So this is the test bed we're working in, and this is a really good thing for us to have these days when we do the procurement for the whole region. Because that is a lot of clothes, and there is a lot of lack of trust in every detail. They don't trust the procurers, they don't trust the controller, they don't trust people at all, because they just want this to work, and there is always a lack of clothes because someone eating these clothes in the system. We don't know yet who it is. We have found someone with big belt, but we don't know if they are the ones who are eating them. When we also try to do this, we try to make some kind of looking how the market is with clothes for hospitals, for the healthcare. And to be honest, in Sweden, there are 2 suppliers who are, they say that there is some kind of concurrence. I think it's some kind of, is it oligopoly in English as well? So we have to try, how can we push them a little bit harder? So we just try to split this big procurement in smaller pieces. And we would have more pieces, but we didn't, our bosses don't think we should go so far. These days, they think we were right. We should have been done it our way, the whole way, because it's always end up better then. But still, from one big procurement, it results today that we have 5 new contracts. And that is one of the healthcare clothing who we are buying from the washing supplier. One of them is called Elise. It's a French company, but it's a multinational company who won the contract. And then we have by the operation Textiles, we have the work clothes for the staff in the healthcare as the other people, not the nurses in this one. We have also pillows for the care and washing textile for high schools, folk high schools. And this is about collaboration as well, because collaboration is knowledge about the needs. Because you can collaborate just for fun, but you have to collaborate to get forward in the process. And then you have to get yourself quite a lot of knowledge, but you also have to try to find people who actually can have some knowledge. There is a lot of title, I think Rodrigo said it also, it doesn't matter what you have the title, you have to have a title that also includes knowledge, to be honest. And you don't need a title to have knowledge, because you have to find the people who actually know something about what you will find. And these people together will make a good collaboration. And it's also included when you talk about healthcare, you have the patients. You shouldn't forget the patients, because there could be a lot of people working in the hospital, but if there are no patients, what is the thing about working there? So if you don't including the patients, is this actually the right thing? If we talk about clothes, why do I have clothes when I'm working on hospitals? There are actually different answers you're going to get. So you have to find out the answers, and you will be, you also learn something about the answers, because it's always not what you always think about they're going to answer. So try to find, no, that's, no, it's closing down. This is what the aims was of the new procurement textiles supply then. Is it about the flow in the washing process? and I'm not going to get into that because but it's always about the flow, about the process. We do need a better control about where the clothes are. Who is eating the clothes? How do we find out? Yeah, we put some chip in them. So we have the digitalized the clothes. And then we will know if they are in the laundry, if they are in the hospital, if they are in the transport, or where are they? We're supposed to know much more about the clothes. We also will know how many times do they have actually been washed. We also will know a lot about how people wear clothes in different way, and they, sometimes some people wear clothes. A lot of people wearing clothes. You have to know how actually the clothes is standing. How many washes? For how long can we have this process? Is it 1 year? Is it 2 years? Is it 3 years? It depends. So we have to learn, and that is the digitalization is really important, because then we can follow it over time. And we'll learn a lot about the clothes. We're also optimizing the clothes in track. And this is, these companies, they don't like this. When you optimize them, you also get to know a lot about actually how it is. So the best thing for the environment is to have no clothes at all. Yeah. But some people get upset. But you have to know how many sets, trousers and shirt do you need if you are a full-time worker 5 days a week, or if it doesn't matter. You have to know how few clothes do you need? That is the question. And that answer it depends. But later on, they have said you need 11 sets, and we said couldn't be possible. 11 set, only me. So today we had ordered 7 sets. I do think the right answer is 5 sets, but that depends on the flow. It's the process. It's how the transports, how many transports. But we're trying to make a big step, and the company is actually following us now. They have no other choice, to be honest. So this is some kind of developing the collaboration in the agreement. It's about new materials, because we have a lot of meetings with the supplier to talk about what is the next step about clothes. Is it the same material that they use today? Probably not. So we have to talk about new materials. We have a contract of 8 years, 6 + 1 + 1. How is the washing methods? Today we're washing in clean water. Is it okay to wash in clean water in 8 years? Oh, no, probably not. So we have to talk about new techniques, new way of doing things. And when you involve the supplier in this kind of discussion in the procurement process, you get a higher level of awareness from everyone. And that is the part of collaboration which is the most important thing, I think. Because then we don't talk about money, we don't talk about the contract, we talk about how are we going to save the planet? How are we going to make the right decisions in this contract? And because everyone is a loser if we don't do it, that we have to be aware of. So we have these kind of requirements. This is me and Frida, and I am having the new clothes cooperation, and Ian have the dress, because we have also had dress and ties in this. You can choose dress or tie, or shirt or clothes. So we own this at this time. We actually choose to own the clothes for the personnel to get control. We have requirements for recycled polyester in the healthcare clothing. The other kind is cotton, and that is no good, but we have no choice today. We have removed buttons and zippers, and we have unisex wearing. So this is more tolerant when you have unisex. And we have also changed the scale. So we have this small, medium, large scale. It's easier to find. If you come to the work someday, you use medium, they are out of medium, someone will keep them up, you can take a large one. You will manage. And as I talked about, we have a reduced number of items. And we also have a logic pipe, and that's not so good in sustainability, but it is good when we don't trust the supplier for filling. This is really in Gävleborg. No one else has these clothes. And it's also good for the patients, because when you meet someone in this particular color, you also see this is a person who is actually working here. And that's trust from the patient perspective. And we also have phasing out all disposable materials in this program. So we have done a lot of things, I think. And the operation textiles, because before they have some clothes you can wash and you have some clothes from another material. So we just take the station. We shouldn't have these kind of clothes. Of course, we're going to have a new clothes you can wash. And there was a new standard to support it. And the new standard and the new material also say you can wash them about 100 to 150 times. That's quite a lot. So we, in our region, we say this clothes we have bought, I think we're going to have them for 4 years. Don't have to change them. And we have not so many sets, even on the operation, because we have quite find the level, how many needs you, how many clothes you need per person. And this kind of operation clothes are manufacturing in Sweden and in Europe. That means we don't have to rely on China. There is short ways to get them if you need some more. We also take in our region, we have these pillows before who was from another material. They just have them once and then you throw it away. It is a lot of weight. It's cost a lot of money. But there is an issue with pillows. If you can wash them, but the drying drying process. Yes. Could be if it's too hot, they're going to be not so good inside. If you have them too cold, they're going to be mold in it. So this is an innovation we found when we Googled. So there is some other pillows, and this one on the picture is the one we actually have today. You just sprayed it with disinfection. You shouldn't wash it, and it's better for people with some kind of asthma, allergic kind of stuff. And we also have another barrier, another pillow. We call it the multi-use folding pillow. It's a thinner one, and you can do it what you want if you have broken leg or something like that. It's supported. It's a very supporting pillow. Sounds crazy, but it is. But as it is thin, it's not so. You can wash it, and that's going to be fun.
It's easy to dry also because it's thin, so
Yeah.
that's not the problem with the.
No, I talk too much English. I can't find words. But this pillow, this is also. We are aware of MDR. This is medical classified, so we know it's a good product. It's better from a hygiene point of view, and you don't need the transport because it's following the bed. And this we talked to a hospital in Denmark, they have had this pillow for 6 years before they change it. So it's not that expensive either. So the result from our sustainability perspective is that we actually get a lower environmental impact. There is lower costs. I can't actually tell you but there's a lot of million Swedish crowns. And we have increased participation during the whole process with different kind of stakeholders.
From which requirements you had you gain lower costs? Like you know what I mean? Like which of those requirements allow you to have a product that was cheaper?
Everyone,
I think in all the cases.
all the cases.
Those and the pillows, actually, the pillows were.
And also the operation clothes as well, because further on you have these you can only use for once. So every procurement is better economy for the better economy.
What are the needs of the patient and the staff in the story?
We can take that. we take that out actually. We did, I have said the we took that away actually, because we can't talk about everything, but we did the sensor analysis of the clothes, because I am a sensor analysis, that's what my PhD is about. So we did that with the sock. So we have during the corona, so we should look at us, we have, something, and they did kind of working to they should sit down and so feel the difference. And then we had operational textiles. They had it for 3 days and worked in it for 2 days, and then they had a survey which we were happy to fill in and see, okay, how much did you like these or these? We did a sensor analysis.
And we also said the price is nothing, it's what you choose.
Yeah.
So if they said we have 2 different kind of clothes on the operation clothes, and we say it doesn't matter what it costs, you should be, we will buy the ones you think is the best. And that was we do. The cost wasn't it wasn't different so much, but still we haven't taken that in consideration at all. Is what they actually think it's the best for their work.
In terms of cost, do you also count the cost for the time it took you to do all this analysis?
You mean the total cost?
Yeah.
No, we haven't done that yet. You're not ready yet.
Yeah.
So maybe we want to look at.
Yes, of course, we should take that in consideration, but at the first time you do this kind of frame-like model work, it took a lot of time for us. But I told Peter during the coffee break, we are getting faster and faster, because when you talk to people, when they tell you the truth, and if you go into how many people are you going to interview, and when you are fulfilled, when you know enough. And when you have learned that process, this process will be quicker and quicker and quicker. So, and when more people have been involved in it, it also get collaboration, get quicker and quicker, because somehow people like to work together. They like to come together and they can find out that, yes, this was a good result and I'm a part of this result. And they also get a little bit, oh, I'm a part of this. So I think that is the main thing. They get something to say. Actually, their work is important, and my knowledge is important. With your knowledge and knowledge together, we have make a good result, and we can be a team of good results. So these days, I said, next time I will be a part of the process. So I think it's growing, and that is worth the time. Because even if people stop working at Region Gävleborg, they probably will take the knowledge to the next working place they go to. So if it is true, if we have something we have found out, it's probably will grow with people. I can see in another way, because you can bang it into your head. They have to experience. They have to say this is a nice way of working. So
We have one.
Förlåt.
Wow. Yeah. And then you, and then you, and then you, and then you.
You have to